It's funny, isn't it? San Francisco, they're so progressive you can't even get a plastic straw for your iced coffee.
Oh, yeah.
Banned, they are. But not so long ago, you could walk right up and get plastic straws, foil, pipes, all for smoking fentanyl.
Wow.
Kind of makes you think, big change in how they're dealing with the drug problem, that's for sure.
Yeah, I mean, that's pretty striking. San Francisco, right?
Yeah.
Like, of all places. Shows how complicated this whole thing is, doesn't it? Like, what's the right way to handle these big health problems, What do you have to give up to get something else?
Exactly. And that's what we're really digging into today. This deep dive is all about San Francisco and this brand new policy they've got on, handing out stuff for fentanyl and other drugs. We've been going through a whole bunch of reports, and what we want to do is, get past the headlines. We want to figure out what's really changing, what's behind it all, and how are people reacting? Because it's a lot of different opinions out there, but we're going to break it down, give you the info you need without, overloading you.
Right on.
So let's just jump right in. What exactly is changing here?
Okay, so the main thing is, starting April 30th, 2025, San Francisco is going to have a new rule. If you want those supplies, the foil, pipes, straws for fentanyl, even clean needles, you got to agree to counseling, treatment, or at least get connected with some kind of support services. So before it was like pretty much no strings attached. Now things are different.
So that's a pretty big shift, isn't it? From just giving things out to more like trying to get people in to help. And this isn't just about who gets the stuff right. It's also about where they get it.
You got it. They're moving all that smoking supply distribution indoors. So no more, handing stuff out on the street corners. And this is important, clean needles. Those they're still going to give out on the streets to some extent, although even then they'll be trying to get people connected with services.
Interesting. So even with the change, they're still recognizing that needle exchange is really important. I mean, it's been shown to work, right? To help stop the spread of diseases.
Exactly. Strong evidence for that.
Okay, so this is a pretty dramatic change. Why now? What's going on in San Francisco that's making them do this? I mean, they used to have a totally different approach, right?
Yeah.
What's the mayor, Daniel Lurie, what's he saying about all this?
Well, Mayor Lurie, he's been really clear about why they're doing this. It's the overdoses, 2 people dying every day in San Francisco. He's like, we can't accept this anymore. And he said, pretty bluntly, we're not going to just sit here and let people kill themselves on our streets.
Wow.
So they're not just trying to keep people alive anymore. They want to actually help them get better, get them off the drugs. And this new policy, it's a big part of how they're trying to do that.
So this is like their big plan then?
Yeah, this policy is a core part of what he's calling his breaking the cycle plan. The whole idea is to use these supplies, the pipes and needles and stuff, as a way to get people into treatment, into support systems, get them on a path to recovery.
And it sounds like they're not just thinking about the people who are using drugs, but also like the whole city, right?
Oh, yeah. Mayor Lurie talks a lot about making neighborhoods safer for everyone. People are worried about public drug use, how it affects the city. So this policy is trying to deal with all of that. The overdoses, the impact on the community. It's all connected.
It's a multi-layered issue for sure.
Yeah.
So we've heard from the mayor. What about the public health side of this? What's Dan Tsai, the DPH director, what's his take on this whole thing?
Well, Tsai is saying a lot of the same things as the mayor. He's really worried about these overdose numbers, and he keeps saying that the Department of Public Health has got to look out for everyone, not just the people using drugs, but the whole city.
Right.
So they're all about moving people away from just using on the street and into treatment, getting them on the road to recovery, for the long haul.
And it sounds like they're going to be watching this very closely, right? Seeing how it all plays out.
Absolutely. Tsai's made it clear they're going to be tracking the overdose rates and keeping an eye on how many people are getting sick with, HIV or Hep C. They want to see if this policy is actually working, and if it's not, well, they'll try something else. It's interesting, right? They're trying to balance harm reduction with getting people into treatment. It's a tough question. Can you really do both at the same time?
Yeah, and it's a question a lot of people are asking right now. So let's talk about the people who support this change. We talked to Keith Humphreys at Stanford. What's he saying about this new policy?
Humphreys is actually pretty optimistic about it. He calls it embracing what actually helps people recover. He thinks this might be part of a bigger trend, a shift in how we think about harm reduction, especially out here on the West Coast. Maybe we need to focus more on treatment, he's saying.
So Humphreys is seeing this as like a good first step, maybe?
Yeah, I think that's a fair way to put it. He thinks they're on the right track.
Okay. But of course, not everyone's happy about this. There's been some pretty strong opposition. What are the nonprofits and the harm reduction folks saying? What are they worried about?
Yeah, they're not holding back, that's for sure.
Yeah.
Laura Guzman from the National Harm Reduction Coalition, she called this policy moronic, straight up. And, she's not alone. A lot of folks in that community, they're worried that if you make people go to counseling or treatment to get clean supplies, you're going to lose the people who aren't ready for that.
So they're afraid people will just go back to using dirty needles or sharing pipes.
Exactly. And that could make things worse, right? More overdoses, more HIV.
And Dr. Josh Bamberger, he had a really specific concern about pipe sharing. Can you tell us about that?
Right. So Bamberger's really worried about people sharing pipes between meth and fentanyl. See, for opioids, there are treatments, medications that can help people get off them. But for meth, it's not so simple. There's not really a good medical treatment for meth addiction. So his worry is if meth users can't get clean pipes easily, they might end up sharing with fentanyl users, and they might not even know there's fentanyl residue in the pipe. He was pretty blunt about it. He said, someone asks, can I use your pipe? And then, boom, they're dead.
That's terrifying. And the San Francisco AIDS Foundation, they're also really worried about this whole thing. What are their concerns?
They're saying this could push people back towards injecting drugs. Tyler Termeer, their CEO, he said this is going against all the evidence-based drug policies out there. See, they were pushing for the safer smoking supplies to try and get people away from needles in the first place. Because injecting is so much riskier, right? Higher chance of overdosing, and you've got the HIV and Hep C risk on top of that.
Right. It seems like we're kind of going backwards then. And this is San Francisco, right? They were pioneers with harm reduction going way back to the AIDS crisis and needle exchanges.
Exactly. Back in the 80s, when the AIDS epidemic was hitting hard, they were one of the first to start handing out clean needles. There was a lot of pushback then, too, but it really helped slow down the spread of HIV. Harm reduction, the idea is to meet people where they are, make things a little safer, build some trust, and maybe down the line they'll be ready for treatment.
Right. So we've talked about the concerns, but we also need to talk about the logistics. When is this policy actually happening, and how's it going to work?
So it kicks in on April 30th, 2025, and then by May 30th, all the smoking supply distribution has to be moved indoors to those city-run places. But here's the thing. At first, they weren't really clear about what the counseling would look like, how long would the sessions be, what would they talk about, who would be doing the counseling. So there are still some big questions about how they're going to make this work in practice.
And as we've been talking about, there's also the worry about what might happen, even if they don't mean for it to.
Exactly. Like, what if it just gets harder to get clean supplies? People might start sharing more, or even a black market might pop up, and that could make things even more dangerous. The city's going to have to really keep a close eye on things.
It's a really tricky situation, and it feels like this is all happening against a backdrop of political change in San Francisco, doesn't it?
Yeah, good point. The city's definitely become more moderate politically, and people are just fed up with this drug crisis. I mean, over 3,000 people dead from overdoses in the past 5 years. That's huge. They feel like they've got to try something new, even if it means changing things up.
Right.
Although it is important to remember that they're not getting rid of everything. Naloxone, the overdose reversal drug, that's still going to be available, no questions asked. They're still committed to saving lives, even while they're trying to get people into treatment.
Okay, that makes sense. We also heard from Cedric Akbar, who runs a recovery program now, but he used to be an addict himself. He seems to be behind this change.
Yeah, Akbar is one of the people who's actually supporting this. He called the old way of doing things ideology gone crazy. He's been there, he's been addicted, and he thinks just handing out supplies without trying to get people into treatment wasn't really helping them.
So he's coming at it from a different angle.
Exactly. He's like, look, I know what it's like. This is what needs to happen.
Makes sense.
Yeah.
And we also talked to Amber Miller, who uses meth and has gotten free pipes before. She had a really interesting perspective on this whole thing.
Yeah, Miller's experience is really important to think about. She said that having all these supplies so easily available and seeing how, accepting people were of drug use in San Francisco, it actually made it harder for her to get help. She felt stuck.
Oh, wow.
Yeah, it's like nobody was pushing her to change, so she didn't.
Yeah.
And she wasn't happy about that.
It's like sometimes you need someone to give you a little push,
right?
Even if it's not what you want to hear at the time.
Right. It's tricky, right? Like, how do you help people without taking away their choices? It's a tough balance. And it's not just about the policies either. The city's changing its whole message around drug use. They used to have those billboards, the ones that seem to be saying it's okay to use drugs with your friends.
Yeah, I remember those.
Well, those are gone. Now they're putting up ads about recovery, about people getting better. It's a different message entirely.
So it's a really interesting situation, isn't it? You've got the city trying to deal with this terrible overdose crisis. They're trying something new, focusing on treatment. But then you've got the harm reduction folks, and they're worried this is going to make things worse.
Yeah, it's a real dilemma. And it's even more significant because this is San Francisco, a place that's been so progressive on drug policy for so long. Now they're changing course, and everybody's watching to see what happens. It's a big deal.
It is. And it really makes you think, what's the right way to handle a problem like this? Where do you draw the line between helping people and keeping them safe? And what about the community? How do you protect them too? There's no easy answers here. And what San Francisco decides to do could have a big impact on other cities too.
Yeah, definitely. This is something we're all going to have to keep an eye on. It's not just about San Francisco. It's about how we deal with addiction and overdose in our communities.
Exactly.
Yeah.
So as we wrap things up here, here's what I want you to consider. We've heard a lot of different perspectives today. But what do you think? What's the best way to handle a crisis like this? How do you balance individual freedom with public safety, and how do you help people get better while also protecting them from harm? And what about the long-term consequences of this policy? Could it work? Could it backfire? These are tough questions, and the answer is going to matter not just for San Francisco, but for all of us.